Hi, Linda. So thank you for taking the time to fill out our 3-item scale that we're using to better assess your chronic pain and understand it. So if it's okay with you, I'd like to go over your answers, and I have some additional questions for you as we start to look at creating your future treatment goals. Would that be okay?
Sure. But does this mean you're going to take away my pain pills?
No, the goal is not to take away your pain pills, but we do need to assess what benefits you're receiving from them, along with the risks and side effects. We do this with all treatment modalities. We now know that chronic pain is actually very complex, and we do have a lot of newer treatment modalities that are more helpful than pain pills alone. And so I will be talking to you about some of those as well.
Yeah, that would be great to hear about other plans to help with my pain.
Exactly. So I'm hopeful that there's some other options for you that are going to help. And let's start talking about your responses. So the first question, what number best describes your pain on average in the last week, right? And 0 is no pain and 10 is being the pain as bad as you can imagine. So I'm looking at your score and you answered 8. Is that correct?
Mm-hmm.
Wow, okay, so you're not getting that much pain relief, really, if you're scoring that high at an 8 and you're taking what we consider a fairly high dose. So another way to look at that would be to say you're getting about 20% pain relief from your current narcotic pain pills. Is that what you're expecting from them?
I really expect to be completely pain-free from all of the pills, but I guess I'm just, I've been taking them for so long that I figure I'm just going to be in pain for the rest of my life.
I can see how you would feel that way. What if I told you that some of the other newer treatment modalities we have could give you 30%, 50, 70, 80% pain relief, don't involve increasing these pain pills? Would you be interested in hearing about some of those today?
Yeah, I would. No other doctors talked to me about this before.
Well, like I said, chronic pain is very complex. As we study it over time, like any chronic disease, things change. We used to think that narcotic pills helped all kinds of pain, and now we know that they don't. In fact, actually, at higher doses, they're harmful and they're not effective for your pain. So we're starting to move towards looking at your function, your quality of life, and not just having you answer a pain score like we did before. Does that make sense? Mm-hmm. So let's move on to your next question, which kind of goes into this. What number best describes how, during the past week, pain has interfered with your enjoyment of life? And you answered 8 to this question. Is that correct?
Mm-hmm.
So out of curiosity, what brings you joy? What do you enjoy about life?
Well, I used to really enjoy being outdoors, like hiking or fishing or gardening. And, now I'm just taking my pills in the morning and napping on the couch all day.
So your current treatment regimen that we're doing right now with just the pain pills is not really helping you enjoy the things you want to do, is what I'm hearing from you. So what if we could start with some small goals today to get you back to enjoying some things in life that you used to do? How does that sound?
Is that possible? Won't I be in more pain with these things?
So I actually have looked at your pain diagnoses and your imaging and other results. And what I actually think in your case is you might be having more severe pain from not moving your body and not doing some of these things. Now, we call that deconditioning. So your muscles now are a lot weaker from sitting inside, right? And I think actually as we start to move you a little bit more, you're actually going to have less pain and enjoy your life.
Okay, but I've always been told if you have pain, you should rest. Where do we even start with this?
Well, I think what's important is you pick something meaningful for you that's reasonable, and we decide on this together. So is there something you could do over the next month or start to work towards that's a small goal of being outside?
Yeah, I guess I could take a walk around the block, and that way I'd be outdoors and in the sun, and then grab my paper on the way back in.
Right, so that's a great goal, that's achievable, and I know that your body can do that. And it may be that the first day or the first week you walk to the end of the driveway and back, and you try that, and you work your way up to a block a day this month, and then we talk about that further. I'm also wondering though, if you're going to be outside, Would you be able to sit outdoors at another time during the day? Just start to sit outside, not exercise, but start to enjoy the outdoors like you used to do.
Yeah, I have these great chairs outside. I could be in the sun instead of just sitting and sleeping on my couch and recliner all day.
Even starting to move from your recliner and sit outside is going to help strengthen some of your muscles. So that kind of brings us to the last question I want to ask you about. What number best describes how, during the past week, pain has interfered with your general activity? So again, you answered fairly high, a 7. So I'm curious for you, general activity, what's that mean for you?
So it's cleaning the house, cooking, doing errands. Right now I just take my pain pills and I'm groggy, so I shouldn't even be driving to do those activities.
So you bring up an important side effect from narcotic pain pills. And I think you're having, some side effects, and also the dose you're on is actually a very risky dose. People die from that dose, even accidentally and from taking it appropriately. So what I want to consider and I want us to do this month is I want to start with a very small dose reduction. And when I say small, I mean if you're taking 8 pills a day, what about 7 pills a day? Would you be able to do that?
So which one are we talking about?
Well, I think that's something you can help choose. So if you take 2 pills 4 times a day, is there one of those intervals that you could take 1 pill instead of 2?
Yeah, I guess midday, since that way, I could work on things like being outside and not just napping during the middle of the day.
So we can talk about that next month. We can see how you're doing. And I'm confident that you're actually going to feel better, that your function's going to increase, your quality of life's going to increase, and your pain is actually going to decrease as we do these. So what I'd like to do at the end of our visit is talk about some of these other treatment modalities with you that I mentioned at the beginning, and maybe you would be able to pick 1 or even 2 to start with this month that I could refer you to. Would that be okay?
Yeah, I'm excited about that, hearing about other things that could help than just the pills. Thanks for really listening.